What's going on, people? Welcome back to another episode of the Chatting in the City podcast, brought to you by V-TRaC Lab at the University of Ottawa. This is the second episode, well, two episodes in 2 weeks. I'm proud of myself. Usually it takes a little time to get these episodes out, but I'm trying to do my best to kind of, keep it going, keep putting them out there. And today I am here with a special guest, coming to us live from Kentucky, Louisville, Kentucky. He is a clinical psychologist. He is the founder and director of the Kentucky Center for Anxiety and Related Disorders. Dr. Chapman, welcome to Chatting.
And it's a pleasure to be here. I really appreciate being on. Thank you for having me.
No, it's my pleasure, man. I was so excited when you actually agreed to come do this, and I have so many questions, but we're going to try to take them in turn and go slowly. I guess the first question is, what is it that you do?
Yeah, it's a good question. So, like you said, I'm a clinical psychologist and I specialize, right? So anxiety and related disorders is my lane, so to speak, right? So I see other things that happen from time to time, but ultimately my day-to-day really is helping people who struggle with anxiety and related disorders. Just for example, social anxiety, panic, agoraphobia, OCD, trauma, PTSD, skin picking disorders, hair pulling, like all of those are under the anxiety umbrella. So I specialize in cognitive behavioral therapy, which in many ways, of course, is the gold standard for all that. So, I specialize primarily in time-limited treatment where I'm helping people become their own psychologist. So it's not counseling per se, right? Like I give wise counsel to people, but it's not a cross your leg, tilt head, awkward smile, what would you like to talk about sort of vibes. It's not that. It's more so like, here's the symptoms you have, so let's get it. So ultimately, that's what I do on a regular basis.
Nice. And I like that emphasis on trying to get the person to actually become their own psychologist, be able to help themselves instead of essentially coming back to you for 10 years,
right,
on and on.
Yep.
I like that. So CBT, you mentioned that briefly. Can you break it down? What does that entail? Because I'm in psychology, so I kind of know what that entails. But for most people out there, they don't know what CBT is.
Yeah, it's a great question, boy. So CBT is cognitive behavioral therapy. And the premise behind CBT is that your emotional experiences have three parts. You have your cognition or thoughts, what you say to yourself, your feelings, which is really physical sensations. So what I experience physiologically in my body, and then my behavior or how I respond, what I do as it relates to emotional experiences. And what we find with CBT is that teaching clients the interconnection between their thoughts, physiological experiences, and their behavior is the key to regulating emotions. And it doesn't really matter what the emotion is. That's the T, right? Is that it's not just anxiety. It's if I struggle with anger, disgust, sadness, slept on emotions, as I like to say, like things we don't typically think about. Disgust is one of those things people don't really think about, right? But that's something you see with contamination concerns, phobias, and things like that, blood injection injury phobia, stuff like that. And ultimately teaching a client that if you can regulate that, then you're able to reprogram, right, associations that you learn in your brain as you confront situations that trigger distress, and then literally become your own antidepressant. So CBT like really makes you a superhero, really.
Yes, sir. Yes, sir. And on your Twitter, there's a hashtag as they do, hashtag CBT Works. And I'm kind of curious how that came about, because obviously, like I said, I do know a little more about CBT and kind of why it came to about, there was a sort of focus on medication rather than actually trying to engage a person in a cognitive behavior or something they can actually, a tool they can use rather than medicating them. So could you sort of get into how the CBT Works hashtag came about?
Yeah, of course. So like on Twitter, one of the contingencies I have on Twitter, like a lot of people who know me personally, boy, as I say that I say facts a lot. And that's true. Like I don't cap, and I also say facts quite a bit. And CBT Works is facts, right? So ultimately CBT Works is the hashtag we use. Why? Because it works, right? So anytime we talk about treating various syndromes and symptoms, right, we tend to shy away from labels. I do, at least. But like when we're treating anxiety and related symptoms, we always talk about hashtag CBT Works because it is the gold standard treatment. As you know, medication typically is the first line treatment for most types of symptoms and symptomology, right? But the best available treatment for anxiety related symptoms is CBT, and it shows trial upon trial that it's more effective, right, than other types of therapy, as well as medication for certain problems. So again, hashtag CBT Works because it does. So we always try to put that out there to educate the public on like, hey, help's available. It's time limited, and it's something that, it's something that you can easily understand if you apply it and you're motivated to do it. So
All facts. All
yeah,
facts.
facts,
No
straight up,
cap.
no cap.
All right. So if somebody comes to you with somebody's been struggling with generalized anxiety disorder,
Mhm.
how would you use CBT to help them?
Yeah, that's a great question. And I think that when we think about, say, GAD or generalized anxiety, it's funny because, like, if I, take that and then add some things to it, like social anxiety disorder or
Mm,
panic disorder or agoraphobia, the way we see things, Boaz, is interesting because as a researcher too, we find that all those disorders that you and I are talking about, they all come from the same place, right? Our learning histories dictate what our focus of anxiety is on, right? And people are predisposed to have big feelings, as we like to say, right? If I get salty, I'm big salty. If I'm high, neuroticism, right? Neuroticism is the problem that many people who struggle with anxiety have at a temperament level, and that interacts with what they learn. So in the case of GAD, it's this idea that my thoughts in and of themselves, right, will lead to catastrophe. So with GAD, it's I have this strong arousal in my body associated with negative outcomes, right? So
mm,
ultimately, exposure is a super potent ingredient of CBT, part of the B part, and confronting situations where I have learned these associations in my brain and learning how to regulate my emotions in that context is the key to changing chronic worry. So in the case of worry and GAD, it's me doing things like imaginal exposure, where I'm actually high key confronting the thing I'm concerned about until my brain essentially says, yeah, shrug emoji, right? It's not as
right.
big a deal as I thought, but it's not pushing it away or suppressing it. Like, think happy thoughts, right? That doesn't work. It's more so saying, no, I need you to not only think about the worst case scenario, but I also need you to say out loud how you feel about the worst case scenario, because
Mm,
worry is a form of avoidance.
mm.
So if I confront worry, then it loses its sting, right? So that's kind of how CBT would work with GAD and worry, and at the same time, your thoughts change by virtue of the catastrophic outcome not happening. So you have
Right.
to think differently as a result.
Yeah, exactly. It's a sort of conditioning. You expose
Indeed.
yourself to the thing.
Yep.
The worst
That's
case scenario doesn't happen. You're like, well, I guess that was, sort of some sort of illusion that I had in my mind or something like that. And exposure is interesting. It's very counterintuitive because for
right. Mhm.
most people, you'd think, if that thing terrifies me, I don't want to be anywhere near it.
Right. Facts.
But then research shows actually, if you try to slowly
Mhm.
expose yourself to it, like you said, starting with just thinking about, exposing yourself to it, just imagining being in the situation, and then moving towards maybe getting, if you're scared of elevators, maybe looking at the elevator first,
Mhm.
maybe
Mhm.
moving towards it 2 steps, maybe even entering in one, right? So this is all gradual exposure.
Indeed.
You'd think it's probably the worst thing you can do, but it actually helps. Like you said, it's the opposite of avoidance. It helps you.
It is. That's right. Yeah, because avoidance maintains that fear long term, and that's the irony is that it's a paradox. Well, it's a paradox, really. It's like when I avoid, I do get relief, but that relief is always temporary because it backfires and
Mhm.
perpetuates my anxiety about that situation. So my brain associates avoidance with that arousal, right? So the next time I feel that way, it's like, oh, I got to avoid it to get that same relief. So it's a vicious cycle. But in reality, when I confront it, emotions ebb and flow and they naturally come down if I allow it to. But most people who are anxious don't see that happen. So,
Okay. I want to get into something slightly, well, I guess it is a continuation of the question. It's about culture and mental health.
hmm
Um, Yesterday I was reading a chapter you wrote in Adult Psychopathology,
yeah.
about sort of the how essentially culture affects the presentation of psychopathologies.
hmm
Um, could you explain? Because I mean, within clinical psychology, within psychiatry as well, the DSM has these categories for symptoms you should be looking for, maybe some cardinal symptoms you should be looking for certain disorders, and if the person meets them, then you can kind of
Right.
diagnose them with the disorder.
Right.
But something that's fascinating is that those symptoms don't necessarily carry over across cultures,
Yep.
right? So in the sense, like the phenomenology across cultures looks different for people who might have, say, depression. Over
Yep.
here in the West, whatever, Canada, all the states, depression might have certain symptoms that seem to be more sort of that are more psychological distress, so within the mind, let's say. Whereas if you go across cultures, you have people who are they exhibit more somatic symptoms, like let's say in China or maybe in Africa and
Uh-huh.
stuff like that. Why does that happen?
Yeah, it's a great question because I think that we have to, again, like you mentioned, the DSM. I mean, historically, it has a very Eurocentric vibe to it. So ultimately, when you look at research trials and studies, you find that the majority of those, right, historically have been with non-Hispanic whites. So when you look at research studies that only examine syndromes in non-Hispanic whites, you tend to base it upon, categories associated with what you typically see. So with that being said, we know that there's cultural variation with the phenomenology of these symptoms because your culture of origin significantly influences your worldview and how you perceive the symptoms that you have to begin with. I mean, even like the causes and etiology, right? It's like, is it delusional to say that the devil's attacking me? Not necessarily, right? Is it delusional to say that, well, God told me that? Not necessarily. Like these are all parts of worldviews that we have from a cultural perspective that are absolutely sanctioned. But ultimately, if you're saying that in a context in a larger culture that doesn't understand that manifestation, then you tend to explain things away like, oh, that's weird, that's aberrant, that's abnormal. And that's obviously misleading because that's not the case. I have too many examples for you. We can do that on another podcast. But I have too many examples for you about how that's happened in clinical practice. And we can talk about that another time. But to your point though, there's also a stigma associated historically with people of color with mental health, right? So ultimately, it's a lot easier and much more accepted to explain my mental status by saying somatic symptoms or physical symptoms, right? So if I were to say that my nerves are bad, for example, which is like some cultural nomenclature that many Black folks in the US would say, it's like my nerves are bad. Well, that implies that there's a physical problem. That's less stigmatizing than saying, yo, I'm anxious and I'm about to flip out and pop off, right?
Mm-hmm.
Because ultimately that could get you in trouble and people will be like, oh, cousin Mike, he's crazy.
Yeah.
There's a stigma associated with accepting mental symptoms or cognitive symptoms as the case. So saying that I have physical complaints and somatic and bodily complaints tends to be more socially sanctioned and culturally sanctioned in many cases across the world. So
Right. And that's exactly what you wrote in the book. That's what came up.
that's
The
good.
distinction between basically the 2 points being stigma and also how people across the world sort of think about essentially their well-being, how they appraise what's happening to them.
Right.
And the part about stigma is interesting to me because yes, physical symptoms would be more widely accepted, especially in the Black community, because there is something about mental health. If
Right.
you say you're being anxious, people assume you're just right out of your mind. They kind of take anxiety to be the most extreme thing that you can have, right? Which is obviously it's not helpful because a lot of people are anxious. And so with that, they can't really express it because they're like, I don't want to be that person. Like you said, I don't want to be cousin Mikey. I don't want to be the
Right.
guy who's losing his mind. So I'm gonna just say, hey, my nerves are doing whatever. And I'm asking this question because I was born in Africa and my family moved over here 2008, I think. And so I was actually, I guess, realizing some of this stuff in myself. Like the last 2 weeks of April, I just finished exams and, exams are stressful and all that. And I was feeling a little low and I was feeling a little depressed, but it wasn't in the sense that it's all in my mind. I was feeling a lot of bodily fatigue, just a lot of pain in a way. And I just spent most of my time in bed because I was just exhausted, right? Usually I like to be a guy who's out there being active, doing this, doing that. But it was more so that the symptoms present themselves within my body, right? Rather than sort of having the whole thing. Even with that, there was still some aspects of sort of like, I guess like a rumination, just thinking about certain things being futile, this or that, whatever. But it wasn't, to me, it was more so within the body rather than up here. So that was interesting.
That is interesting. And I would add, Boaz, to your question, another thing that I've written about and talked about in the past is this idea that across BIPOC, right, Black, Indigenous, people of color, we also find that what we deem as a false alarm in the disorder sense, right, like somebody having a panic attack in a crowded place or someone having a traumatic experience actually, right, like being assaulted or something like that. We talk about these ideas of true alarms and false alarms and how those learned associations are powerful for your hippocampus, the memory center, which creates a lot of the memory associations that we have with like phobias and things like that. And what I also argue is that for people of color, we have true alarms all the time that are not accounted for by that diagnostic criteria.
Right.
For instance, I live in, Indiana, though my center is in Louisville, Kentucky, which is where I was born and raised. And like people like look at me funny and think, wow, Dr. Chapman, you actually have heart palpitations when you cross the bridge and there's a cop waiting on the side of the road with a radar gun? Yeah, I do, because I don't have PhD on my forehead. You know what I'm saying? Like people don't know that I'm a psychologist unless they look me up and then they like apologize, right?
Right.
So at the end of the day, we have these true alarms, being followed in the store, right? Driving while black, like all these examples that are absolutely traumatizing to Black folks that are not accounted for by diagnostic criteria. So that's the reality that we live in too. So that's the other thing I'd add, is that's part of our shared experience culturally too, that is not pathological, right? How I respond to that
Right.
and having like heart palpitations and shortness of breath isn't at all pathological.
Right. And what do you think about the move to, I guess, move away from a categorical sort of diagnostic thing to more of a dimensional thing?
I'm a huge proponent of that,
Okay.
not only from a cultural standpoint, but from an empirical one. Like all of our research data supports that. And it's like I said earlier, when we think about the temperament factor that is at the heart and soul of all things emotional disorders, which is what we call neuroticism, that basically just means I have big feelings, right? I just am
Mm.
genetically predisposed to experience emotions intensely. Literally, that coupled with my learning history is what triggers these manifestations. And here's a nice quote that I like to use, Boaz. I basically tell my clients when I work with them, I'm like, look, I'm not big on labels for a lot of reasons, but one I'll tell you is this: disorders are just trivial manifestations of one problem, and that
Mm.
is a difficult time regulating core emotional experiences. So if I can help somebody regulate those core emotional experiences, then those manifestations dissipate. You know what I'm saying? So we eliminate avoidance and worry and panic, right?
Mhm.
Sort of things people struggle with. We get rid of those based upon our ability to regulate the core emotions.
That's fact. Another question, I guess, kind of applied to myself as well. I'm curious so about neuroticism specifically.
Mhm.
So people who have big feelings, because I think myself, I don't necessarily have big feelings. I've noticed that when I'm happy, I'm
Mm.
not overjoyed, I'm not over the moon. And so when I'm sad, I'm not, in the dumps.
Right.
Does that kind of make sense in the sense that I don't want to say it's like a limited range, but it's not as broad, let's say.
Indeed, you're absolutely right. So you don't have to necessarily, because that's really a risk factor more than anything, right? Like there's
Okay.
people who are high neuroticism who never develop anything,
Right.
because it's a double-edged sword, right? If you high neuroticism, you're probably going to study hard too. So yeah, like you said, for many of us, we don't have to necessarily be high neuroticism just because of the different pathways that things develop, right? We talk about direct traumatic experiences, right? That's one pathway which we could start manifesting these negative symptoms. Another one is observational learning, right? Having your parent, like my mama used to always say stuff to me like, boy, you better put a coat on or you're going to get pneumonia. And I'm like, as an adult, yo, that's not how you get pneumonia. But as a child, I'm hearing her model anxiety for me, right? It's like, oh,
Yeah.
if I
Yeah.
wear a coat, then I'm not high neuroticism either, but I thought about that and it gave me a pause, you know what I'm saying, to put a coat on when I walked out the door. And then there's informational transmission, right? It's like just hearing about repeatedly. And that's the experience of BIPOC, right? Is that if we hear enough over and over and over and over and over time, that begins to affect you and traumatize us in ways that are not accounted for. So yeah, you're absolutely right. There is a range for that with neuroticism.
Mm. If disorders do sort of present themselves across cultures and across different people of ethnic backgrounds, um, do you have a different approach for helping people, let's say Black people who have anxiety? Earlier you mentioned, CBT and exposure therapy, but it's like, is there something more specific that you do to sort of account for all these other, stressors, like you said?
Yeah, that's a good question. There's a concept, boys, that I use, and it's called fidelity with flexibility. And I
Okay.
think that that's a powerful term because I stay true to what works, because CBT does work, and that is true across culture. So
Mm.
my foundation is that CBT is effective for people of color. With that being said, you have to be flexible in your application of that, though. So, for example, here's a good example. We talk a lot about cognitive restructuring, right?
Mm.
I don't use that term, particularly with people of color, and many of my clients who are even non-Hispanic white, because it implies that the way I think about a situation is wrong, right? Cognitive flexibility, on the other hand, implies that, yo, this could pop off, but there's also other ways to look at the situation. The ones I choose can help me regulate my emotional experiences. So I think that's a good example because ultimately, though I apply, right, the fidelity of CBT and the structure of CBT, like my application of terms and concepts is different. I think my level of hands-on is different. Like I'm more apt to do more in-person exposures with my clients of color and stuff like that. I mean, you got to think, like, for instance, I have a gentleman, he's like grandpa type. You know what I'm saying? We're cool, we're family. And he comes in for treatment and he's not going to trust anybody else to get in his car and drive over an overpass that he's avoided for 30 years, but he'll trust me. Right. So what do you think I'm going to do? I'm going to get in the car with him. I'm going to get in the car with him and coach him up, which is part of exposure, but I would absolutely do more in that regard to build my rapport because trust is a big issue because we've been stigmatized and mistreated for years by the medical profession. So it's really important for me to also make sure that I'm trustworthy. Does that make sense?
That makes perfect sense. Yeah. I mean, if I came to see you and I didn't trust you, I'm not going to let you, I'm not going to just let you get in my car. I'm not going to let you tell me what to do, talking about cognitive restructuring. I'll start giving you a talking to. Like, what are you talking about, man? Like, a big thing is most people don't have access to therapists and clinical psychologists. So do you have any tools for people who have anxiety, but their anxiety might not be at clinical levels, but they still want something to, help them deal with it?
Yeah. So I think in terms of like access, one of the good things that the pandemic has forced our hand on is to make telehealth an option. So we've been much more relaxed across state lines to be able to provide more services. And I think that with that being said, the boundaries and restrictions that we had prior to COVID, one of the good things, I guess, with COVID is that to allow us to be more flexible to help more people. So ultimately, if somebody is, say, like in Toronto or somebody's in New York City or something like that, they're not necessarily restricted to just psychologists and mental health professionals in that area. They actually can jump online and see who's available with telehealth. And, most states and the regulations are okay with that. You're able right now to access mental health providers in other areas via telehealth, which is just as effective depending on the treatment approach. So that's great news.
I guess we can get into some of the more fun stuff. I don't want to keep it for too long. I know you got patients, you got people to expose, you got people to, you got stuff to do. So one of the things I wanted to ask you is about the MCU, right? When I was looking at your Twitter, I saw that you're a big fan. You're posting about there's some Doctor Strange stuff, some WandaVision, some Falcon and the Winter Soldier. And so I wanted to sort of get your views on the top 5 MCU films for you, and I want you to tell me why.
Top 5? Oh man, dang, Boaz, that's tough right there. So can I give you a top 5 with no particular order?
Yeah, that's fine.
All right, cool. All right. So I will say Endgame definitely is top 5. Right? So Endgame's top 5. And I guess the why behind that is that being an MCU, self-proclaimed MCU stan, you know what I'm saying? Like Endgame culminated the first like 2 decades basically of Marvel, right? So it's like if you followed all the chronology of Marvel, Endgame really summarized that very well and opened the door to phase 4, which I'm hype about in other podcasts, right?
Oh yeah. Oh yeah.
Which, with that said, you also have to put Infinity War in the top 5. Many people that I personally know who are Marvel stans like myself would argue Infinity War was better than Endgame. And I think in many ways there was, believe it or not, I think that there's a lot of reason that you could argue that. I think the fight scenes in Infinity War were on point. I think Thanos pretty much like, I mean, think about this, boy. You're going to laugh when I say this, but it's real talk as you get to know me. Check this out. Think about the kind of beating you got to take to beat the anger out of somebody. Like Thanos, like beat the anger out of. I want you to process that for a minute. He beat the anger out of him. So like the way right, didn't he? So like just thinking about Infinity War and the build up with that, and again how that like opened the door for Endgame. I think that's a top 5. I think Thor Ragnarok was a top 5.
Okay, yeah.
Thor Ragnarok was slept on. That's one of the best MC movies, arguably the best, honestly, just because the evolution of Thor and his character, I think, and his story arc was kind of culminating in Ragnarok. So I think that you could argue most certainly, easily, the Ragnarok's top 5. Certainly Black Panther would be top 5 for me. for a whole lot of sociocultural reasons, but
Whole
also
lot of reasons.
you
Yeah.
already know. So I think the Black Panther definitely would be one, and like it really put Black America in the forefront. We came out in droves to see that.
Mm.
So definitely that. And then like there's some toss ups for top. You said top 5. So
Mm-hmm.
I'm just gonna go some honorable mentions with that. But unpopular opinion, Doctor Strange to me is a top 5 movie. I would say Winter Soldier is also possibly top 5.
Yes. Yes.
Winter Soldier slaps, right?
Yes.
And then the other movies are terrific. Don't get me wrong, but I'd say
Mm.
that if you force my hand, those are the ones that I would rotate.
That was interesting because I mean, I was actually thinking about the question the other day. I was like, huh. Most people would go with Endgame and Infinity War. But I
Yep.
kind of thought if you choose Endgame, it's kind of cheating because it's like everything has led up to this moment.
Right.
This is the climax in a way. So this has to be amazing.
Right.
But all that said, it's a great movie. Whatever 2 hours and whatever 30 minutes or whatever it was, is a great movie. And like you said, Infinity War with Thanos beating the anger out of Hulk, that is scary. Especially the scene where what's his name? Ebony Maw was like, let him have his fun.
Right. That right there. Okay. All right. I mean, we were family before the call, but that comment right there tells me where you really are, though, because that's literally what I was about to say. Is let him have his with the hands. Let him have his fun.
It was just, oh my god,
Like
scary. And then Ragnarok, that was I was like Thor as a character. I guess like the whole MCU arc up to Endgame. He has one of the most tragic stories I've ever seen.
Totally agree.
And the scene, I think it was in Endgame when Rocket is talking to him and it was like, so what more do you have to lose? Like just my heart broke.
I agree with that. You know what's ironic about that, Boaz? And this is another conversation, but one of the only other characters I can think of deep in the MCU that people haven't been introduced to yet, it's in the comics, that ironically is supposedly going to be the villain in the 4th Thor movie, is Thor the God Butcher. Like that dude's character arc, I'm gonna need you to look that up, and then you can hit me up, text me or email me or whatever, and tell me what you think about his character arc, because he has a tragic character arc that made him who he is.
Yeah, because I mean, Thor is just broken, and I think what he sells to Rocket is, I just have to kill Thanos. That's all I got. I just have to kill him.
Yep. Which is why he could rock with Captain Marvel, because she had the same attitude.
Oh
and that's why, in Endgame, he's like, oh, I like her because all she's about are these hands and this action. So let's just go kill him. Like there's no other solution.
Exactly. We just gotta get it. And then the other one, Winter Soldier, that's also a movie that's just massively underrated.
Totally.
That movie is, first of all, the choreography, just the fight scenes is amazing.
Yep.
And then you have Sebastian Stan and the Soviet arm. I do not understand like how. So, Winter Soldier in that movie,
yes,
and then Sebastian Stan and Falcon and Winter Soldier.
Facts.
I don't understand. Like, there's just, he seems so much weaker in Falcon and Winter Soldier when nobody could deal with him in Captain America and Winter Soldier. It's just I don't know. It doesn't make sense to me.
I do agree with that 100%. I still don't understand that. I will say my man Zemo though has swag in Falcon and Winter Soldier, just to point that out. And he's over offering these kids Turkish delights though for some information. That's all I'm saying.
Turkish delights in the fur coat. This guy.
Right. I want that coat with the Sherpa on the hood. Come on, man.
Zemo. And all the cars he's got and everything. Oh my god, it's just, it doesn't make any sense.
Right. Zemo looks like he's in a little baby video. Like he's got 5 cars, Lambo trucks. All right, Boaz. Let me rein it back in.
That's hilarious. Before I let you go, I want to ask you two more questions.
Yeah, that's fine.
What's the most positive thing that's happened to you this year? I've been asking the guests, sort of like we said, it's a pandemic, terrible things are happening, but what are some more positive things that have happened to you?
Oh man, well, I'd say that we've had a lot more people to help. I think that our center has been contacted quite a bit by media recently, and the good thing about that is that access to care has improved substantially, right? So we can help more people that don't live here, right? We can train more people to go out and be their own psychologist. And I think that what the pandemic has done for us as an anxiety center is that it's given us more opportunity to pop our knuckles and roll up our sleeves and get more people help. And that can be across state lines or it can be face to face. So I'd say that that's very positive because it allows us to do what we do.
That's a wonderful thing. And how can people get in touch with you if they want to, like you said, if they want to get trained to be their own psychologist or if they need help generally?
Yeah, so a couple ways. So they can go to my personal website is drkevinchapman.com. If they want to check out our center website, they can go to KYCARDS.com. As you know, I'm on social media popping off about matcha or the MCU or psychology. So they can find me. My Twitter handle is Dr. K-Chap, so Dr. K-Chap, which is my nickname, K-Chap. And then you can find me on Instagram, Dr. Kevin Chapman. I'm on LinkedIn, I'm on Facebook. I'm on pretty much all the social media platforms. So if you really want to know what's happening in my life, I go to social media.
Yes, sir. Yes, sir. That's fact. All right, guys, you heard it. Check them out. KYCARDS, Instagram, the Twitters. I'll have it all linked here. Probably do some screen recording, screen sharing here as well to show the people the websites. Thank you so much for taking the time. I don't want to keep you too long. I know you got work to do. I appreciate this conversation. Thank you so much.
Yeah, anytime.
All right, guys. We'll see you next week. Peace.